He is CEO of CDS Services and MedStaff Home Health and Breeze Hospice in Missouri. But we're talking about CDS Services today. Daniel Manny is on the phone. Hi, Daniel.
Hi, good morning. Thank you so much for having me today.
Thanks for being here. Now, I'm live radio. I know your girls are in the car. Hey, girls!
Guys, you want to say hi? They're quiet back there because I told them they have to be.
Okay. Well, shout out to your babies because we love kids. All right. So I think this is genius, Daniel. I know there are other places who offer things like this, but to be able to take care of someone in your home, being a caregiver is hard enough. Doing it for free makes it even harder because then you don't have a source of income. You fix that problem by letting them take care of their own family member and getting paid for it. That's genius.
Yeah, it's a wonderful service. The home care, so there's two different sides to home care, and you can have where you don't have anyone to take care of you, and we can provide you with somebody to take care of you, and that's fine. But there's a whole other end where, it could be your mom, your dad, your cousin, your brother, a friend, a neighbor that you're helping out at home. It could be a part-time thing. It could be your full-time thing. And the person is getting the services and you're helping them anyway. You might as well get paid, to do it. And there's other companies that do this as well, but we pay more than all of them, A, and B, we're local and we take care of our, of our clients and families. That's our number one priority with the customer service. And, the product really speaks for itself. So that's just a quick overview of it.
So when you talk about you pay more than others, what do you pay?
So it's interesting because the state reimburses for this service all the people, the companies like what I have. It's called a fiscal intermediary. And just a quick education, I don't know if I'm getting too detailed, but maybe some of the listeners want to know how it works on the back end.
No, you're fine.
So basically, the state pays all the agencies at $20.92 an hour. Most agencies for the service called CDS Home Care, now the difference between the in-home and CDS, but for the CDS part, they're paying $13.75, $14 at max. We decided that we're going to cut our margins and give it back to the clients, and that's allowed us to add a huge amount of clients all over the state of Missouri, and we're paying $15.25 an hour. And, it's an unmatched rate. I've seen other companies that try sneakily to say, we pay more but they're talking about for the 1 or 2 hours that they have in overtime. But I've never actually seen somebody on that rate. And we've been able to do that by giving everything to the consumers. And we've expanded to five markets throughout the whole state. So it's been a product that's working, and we'd love to do it for anybody who, could benefit from it.
So you do offer it in Cape and areas surrounding Cape?
Yeah, so Cape is a newer area for us. I could tell you in the first month of just doing some basic advertising, we already have about 40 clients in Cape who are either transferring over from a current agency to get the higher rate or to be, with a local company, and many new clients as well.
Mm-hmm. I'm going to tell you right now, my neighbor heard your spot on my show, and she came over and started asking me about your service. I told her to make sure she listens in because she's going to learn about it when I speak to you. So they're hearing the ads and they're curious. So that's a good thing.
Yeah. It's wonderful.
Yeah.
Yeah.
So is it fairly simple to get started, or because, jump through a lot of hoops, that's a turnoff for people?
Yeah. So, we make the process as seamless as you possibly can. A few weeks for the state to approve the change of service. So let me break it in. If you're coming already approved for service from another agency and just want to benefit from our company, that's easy. That'll take a few weeks. The state doesn't even come out. They're just transferring which service that you're working with.
Okay.
If you're a new client, it's also easy. We need 3 pieces of information. We'll get on the phone. We have a dedicated team, that we can reach at any point. We'll get on the phone, get that information. It's basically a Medicaid number of the patient, their home address, and their date of birth, and we could look it up. And we'll submit everything to the state. We'll be on top of that application until the state comes out and does an assessment. The whole process can take, sometimes as quick as 2 weeks, sometimes as long as 4 or 5 weeks. A lot of it depends on how quickly the state is coming out and processing their piece of it. But in terms of the work that needs to be done from the consumer end, it's pretty seamless. And we're there to hold their hands from A to Z, to get them approved for the service.
because it can be paperwork is confusing. And
Yeah.
I think it scares people away. So if you have somebody who's going to help you with that, that's half the battle.
Yeah. We will complete the whole thing. We'll see when the state's coming out to do their assessment on a new client, and we'll let them know in advance. We're just going to be there the whole way throughout the process.
Okay. So now you brought up Medicaid a couple times. Do they have to be on Medicaid?
So here's one misconception I want to make sure to clarify. Only the patient needs to have Medicaid. Now, the person who's providing the care, the caregiver, could be anybody.
Okay.
So, it's a requirement for the patient to have Medicaid.
Okay. So the patient can be, is there a certain age? Do they have to be elderly? Can they be teenage babies? What's the criteria for the patient?
Good question. So, the only age requirement is that they have to be 18 or older for this service.
Okay.
That's the only requirement. And for the sorry.
No, I
Sorry
love
about
it.
that.
I absolutely love it. You have a family in the car. This is live radio. This is what life sounds like.
Yeah, we're talking about a real life caregiver situation.
Exactly.
But I guess
I'm good.
I'm not getting paid for this one, but this is just called good fatherly duty.
Is this your backpack?
I think they're adorable, so don't be mad at them. All right, so as long as they're 18 and they're on Medicaid, they can get your service.
That is correct.
Okay. So when you say they're a caregiver, does that person have to be a CNA or have credentials of any kind?
No, so it's actually they just need to be some basic training with the home health aide. But the beauty of CDS services is they're really working for the client. They're not working for the agency. So we're an intermediary, and this is important to understand because it's different than like an in-home service. We're an intermediary where we'll process the payroll, we'll take off their payroll taxes, we'll keep a schedule and a tracking of their clock ins and outs and all of that. Mm-hmm. But they're really working for the client. So if mom wants to have their daughter work for them, they're working for mom, which means that, they don't really need any requirements in terms of who mom wants to hire. She as a personal person, it's not a requirement what she wants to hire. She can hire whoever she wants.
Well, let's be honest, because mom's kind of picky about who's in her house, right?
Yeah, absolutely. Yeah. And that's one of the things that people love about this is because, and I don't want to knock the other side because we do provide caregivers as well when needed, but one of the things people like about this more than anything else is they get to choose who it is. It's not a random person showing up, and, they love that.
Mm-hmm. So, weird question, but like if I were on Medicaid and I were home and I needed help, I would probably have pets. Do you allow people to have pets where people will like walk their dog or do whatever they need?
Yes, absolutely.
Okay.
Again, going back to the person who's receiving the care is hiring whoever they want as their caregiver. Mm-hmm. So, as long as they're comfortable with it, which, after they're ready, I'm sure they are, then that works. Now, one point maybe you were about to get here, but you mentioned going for walks and things like that. I want to just discuss a little bit about what qualifies for this service. You mentioned age. Maybe you were touching on that a little bit, but what qualifies somebody? Like, could anybody do this service, right? So the answer is, in short, it's not for anybody. You have to have a medical need. Right. But it's also not necessarily for somebody who has an acute medical need. Okay, so somebody who's elderly or there's a disability or they need help in the home, and the general services include shopping, cooking, bathing, cleaning, transportation, activities of daily living. Somebody who needs those services can qualify, and it never hurts. Here's one thing I like to tell people: it never hurts to try. The worst case is they tell you, unfortunately, you don't qualify. You can try again in 90 days. But that doesn't happen most of the time, but it could. It depends on the person. But again, there's no risk in trying. And most people who have elderly and need some help at home, it works for. And the beauty, the idea of the program, just so people should understand, is the state understands that people would rather be home than go to a nursing home.
Hallelujah.
Or assisted living.
I am not going to those Band-Aid smelling places. I'm not going.
I hear you. No, so that's a little bit the idea. It's better for two reasons. First of all, the consumer much rather, if possible, stay at home. They want to stay at home. Mm-hmm. A. B, it costs the state as much as they're paying some money towards this program. It costs the state so much cheaper than what they would have to pay to have somebody live in a nursing home. So the state wants to approve people who would otherwise need to be going to a nursing home or soon be going to a nursing home, in which case they're going to say, we'd rather have them at home with a family member. And that's, not only do I think it's good for the consumers and for the caregivers, I just love, it's a passion of mine. I just love the model so that people can stay home. I know personally, like, it actually was my great-grandmother, but I remember when she was at home for so many years, and then when she had to go to the nursing home, it was such a challenge for the family. But she was able to remain at home due to a service like this for probably, I'm going to estimate just off the top, an additional 8 years, before she had to go into that nursing home. 8 years of, and between me and you, I don't know if she would have, the mental piece of it, like if she was in nursing, I don't know if she would have made it for 8 years, A.
Yeah,
but B, even the quality of life, so it's such a beautiful program. And I'm just a big fan of it. I love it and try to get it out there to help people with it.
Well, next time I have you on, I will dig into some more thoughts that I have about this and want to ask you about. But Daniel Manny, CEO of this new program, CDS Services, how do they find out more? Is there a website?
So we have two ways to reach out to us. We're very quick at responding. We have a team dedicated, ready to roll, local, with local people. So it's either hometeammo.com. So we're the Home Team CDS Services. Hometeammo.com would be the website.
Okay.
And you can fill out a form on our website, or a very easy way to contact us pretty much any hours, but definitely during business hours. Easy number to remember, 844-GET-1525.
Okay.
844-GET-1525.
Awesome. Daniel, I'll talk to you again. Girls, have a wonderful day.
Thank you so much.
You're welcome. I'll talk to you again, Daniel. Thank you very much.
Bye.
Bye-bye.